Hey guys, it's Dr. G, and I wanted to share with you something very interesting that I found out about whether or not it is safe to use an over-the-counter mouthwash. We kind of think of it, at least I grew up, my dad always used Scope was his go-to. He had that every day. My dad always smelled like Scope. He also had heart attack. Um, and whether or not this can increase our risk of having cardiovascular problems, all right, and having blood pressure problems. I was just listening to a wonderful interview Dr. David Perlmutter gave, who is a neurologist who always gives these fun interviews that are very handy. And after watching this interview, I said, I need to make a short video about this because I know a lot of people who use mouthwash not thinking it's a problem. And then I started to look at the research that is emerging around this. And this is pretty new stuff. Your dentist may not even know about this because many dentists will prescribe chlorhexidine washes after procedures. Here's my feeling that there may be some place for those for short periods of time, but there is never a place for long-term use of mouthwash. I'm just looking at a little bit of the evidence here. 3-year longitudinal study found that using over-the-counter mouthwashes, no matter what's in it, is an independent risk factor for the development of prediabetes, diabetes, and hypertension. All right. And it was worse for people who didn't have other risk factors, right? People who weren't smoking, weren't using alcohol, weren't old, and, just young people using mouthwash, increased risk of having problems with their blood pressure and diabetes. We also see a higher mortality in the hospital, like people who are in the ICU who are getting chlorhexidine mouthwashes. In several reports, including meta-analysis, showed that they had increased risk of dying. Okay. So we didn't understand exactly why this would be. Now that mechanism is coming to light. And so just I'm going to list some of these papers below so that you guys can look these up yourself. But here's one. This is the one I was just quoting some things from: the effects of antimicrobial mouthwashes on systemic disease. What is the evidence? This is in a dentistry journal right here. And this I found very interesting here. Antiseptic mouthwash, the nitrate-nitrite-nitric oxide pathway, and hospital mortality. And this is when people started to talk about, could this be why when we destroy our oral microbiome, we kill them all using a mouthwash, that people have an increased risk of these other problems because of they're not able to make nitric oxide in the way they used to make them. Here's just another one: a stepwise reduction in plasma and salivary nitrite, which is the precursor to nitric oxide, with increasing strengths of mouthwash following a dietary nitrate load. So basically, you and I will eat food that has nitrate in it, right? And that can be like a dark green leafies. That's probably the primary place we get that. And they're very good for you on many levels, but one level is they give you this nitrate that the bacteria in your mouth convert. So that's why chewing is good. Chewing is good. So those bacteria are exposed to the nitrate you eat and they make nitrite, and that's a precursor for making nitric oxide. And nitric oxide is something we all want more of. As we age, this drops, and what it does is it opens up blood flow in the body. So if we don't have enough blood flow, we get high blood pressure. Okay, so that seems like that makes sense, right? If the blood vessels will clamp down, that means the pressure is more. So that's what nitric oxide does, is it vasodilates. It's also important in sexual health because the private parts, they need blood flow in order to have an erection, and this is an important part of having a full life, is to have a blood flow. So you want more nitric oxide. And why do we use mouthwash? I would argue that most people use mouthwash because of advertising. Okay. And it does the benefit of having a fresh mouth, which is really all you get when in fact you're actually damaging your friends in your mouth. It's just, it is, the risk benefit ratio is not in your favor, and it's not in your microbiome's favor. So this is what I'd strongly suggest. Ask your friends, are they using mouthwash? And tell them that they should stop, okay? Because it's really bad for you. And even in young people, it's going to start to set you up for chronic illnesses later on because you want more of this nitric oxide. So I hope that this has been helpful for you, and spread the word, you guys. Go ahead and follow my channel. So the next time I find something that everybody needs to know, you're going to hear about it first. All right. Have an awesome day.